You are listening to Hypertension Resistant to Treatment, where you will get knowledge, training, resources, and support for better blood pressure control. If you are suffering with high blood pressure or blood pressure that is difficult to treat, this podcast is indeed for you. Here is your host, Dr. Tanya.
Hi, I'm Dr. Tanya, and I am here to teach you everything you ought to know about hypertension management. I am a clinical scientist, and I've done research over 10 years, and I've found some interesting things about hypertension and blood pressure control and medication taking behavior. I would like to share with you all of the information I've found, as well as all the information that's out there that will help you get control of your blood pressure. Stick with me, and we'll take this journey to help you improve your blood pressure. Thanks for listening. Stop paying too much for your prescription medicine. In this episode, I will tell you what you ought to know about the cost of prescription medicine. Everybody ought to know how to get the best price for their prescription medicine. Here you will learn why the medications are so expensive and what you can do about it to get the best price. So why are medicines so expensive? Well, there are various reasons why prescription medicine is so expensive, but the main reason is that it is just so expensive to develop and market prescription medicine. And this is costing the drug companies a lot of money. And that cost is passed down to the consumer. According to Bloomberg News, the United States has the highest medication prices in the world. On average, each American spends about $1,000 per person every year on prescription medicine. So why are these medicines so expensive? Drug companies, they decide on the medication prices based on supply and demand of the market to support their drug research and development. So 1 in 4 people find that discounted list prices is lower than their insurance company copay. So they decide to not even worry about using their insurance, but they use a discounted drug list instead. Here I will tell you about some discounted drug lists and what you can do in order to stop paying too much for your medications. So what do you need to know? First, you need to ask your pharmacist about that discounted drug list. Now, just about all pharmacists or pharmacies have this discounted drug list. Some are $4, some are $6, and there are various prices. Sometimes you have to be part of a club, like I know Walgreens at one time had a club that you had to pay the $25 up front, and then all year you're able to use that discounted price. I'm not sure if they have that still, but just about all pharmacists or pharmacies have a discounted drug list. So ask your pharmacist for this discounted drug list and compare the cost on that list to your copay. Not all medicines are included on that list, and the lists change from time to time. So just keep up with the list. Usually, it's not really every year, but there are various times when those lists change. So you'll just have to keep up with it, but actually it can save you a lot of money. The next thing that you can do is ask your doctor to prescribe a 90-day supply rather than a 30-day supply, because most pharmacies provide a discount for a 90-day supply versus a 30-day supply. So you will get 90 pills rather than 30 pills. The next thing you can do is inquire about mail order. If you order your prescribed medications through the mail, most pharmacies give you a discount. So ask your insurance provider about ordering the medication through the mail. The next thing you can do is if you have a Publix in your area, get your medications from Publix if your medications are on Publix free list. Publix has a list that has free medications on it. And if you're on those medications, all you would need is a prescription, and that medication would be free. That's simple enough. The two myths that I find that are common about discounted medicines. The first one is that these medicines are different than the medicines that you would normally get that are generic, that are provided by your pharmacist. And that's a myth. These medicines are the same medicines that you would get if your doctor prescribed a medication and your pharmacist would provide this generic medicine. I know for sure that this is true because it happened to us when we picked up my husband's blood pressure medicines one day. It was the same medicine. And just because we didn't ask for the discounted price or the discounted list price, they gave us the regular price. So the medication cost $34 rather than the 90-day $12 that we normally pay. The other myth is the medication is poor quality. Actually, most generic medicines are equal to the brand name medicine. So some people can't take a generic, or some generic medications are not as equal or not equal to the brand. But for the most part, they are equal, or they are just as good or as effective. So I would encourage you to try it out and see. Generally, unless your doctor prescribes the brand name for your medications, you're getting the generic anyway, but you're not getting the discounted price. The last tip I have for you is to use the GoodRx app, or go to their website, Good, GoodRx.com. And if you go there, you can compare your medication price at various pharmacies. And this may be useful. This is a discount that on the app, you can just show your pharmacist the app, and there is a discounted code that they can put into the computer and provide you with that discounted price. And if you are going to the website, you can print out a coupon that can be used at the drugstore. Go to hypertensionresistantToTreatment.com and look at the video that's on the particular blog regarding this medication discount. View that video and it will tell you some more about GoodRx and how to get the discount. And that's all we have time for today. If you have any questions, feel free to ask away in the comments below. If you found this podcast helpful, remember to like, share, and hit that subscribe button to find out when the next podcast comes out. which will contain even more useful information about what everybody ought to know about hypertension. Thank you for listening. I hope you have learned something useful today, and I will see you on the next Hypertension Resistant to Treatment.